Hello, almost pharmacist. This is Karen Shapiro from RxPrep, and I'm sending you my greetings from the pharmacist team here, and also from our office administrators, Salma and Michelle. So if you need help, I'll tell you how to reach us and get some help. The purpose of this video is to get you through the exam with a high score, and we're pretty good at that, so come along for the ride. These are some things that I'm going to address in this video because they're critical for passing. Calculations, biostats, compounding, sterile and non-sterile, case-based questions. About 80%, give or take, of your exam is going to be based on integrated cases. Integrated means that you've got to put the knowledge together from different conditions into one person, because that's normal. Most of our patients are elderly, and it's very unusual for somebody who's 70 years old to have just one condition. So that's what an integrated case refers to. Now, look over on the right here where it says 2/3 of the exam is drugs. So that means you're picking a drug, you're matching a drug to a bug. You're picking an answer, do not use. Perhaps there's an allergy. You're providing counseling. It's all the things that a pharmacist normally does in the course of the day. About 1/3 is everything else. That's still related to drugs, but it's the side topics like how do you prepare parenteral nutrition? What type of test or gloves do you use for sterile compounding? So it's everything in addition to the actual art of dispensing and counseling patients. And that section that is drugs is very important because you do not know what cases, what types of integrated cases you're going to get. So let's look now at the blue type on the left side and read that together. All other topics. What would happen if you got the items above down pat and then you got a case or two on the exam on a topic that you skipped because you ran out of time? That would be a bad problem. And so one of the things I'm going to talk about is how to avoid running out of time. Everything that I go through here is based on the NABP, the National Board's blueprint. And the current blueprint is pictured here. Please make sure that you're using the current blueprint, which is available on the NABP website at nabp.net, and read through the competency statements. Competency statements are NABP's terminology for the blueprint. This is what we're going to test on. And those items that are mentioned by name are, of course, important. And when we develop our course material, we are matching it to the blueprint because NABP will tell you this is what we expect you to know. Here's the current RxPrep course book 2017. And I cut off the bottom, which is what's new in it, because I wanted you to focus, please, on the second sign that says RxPrep's Roadmap to Passing begins with free assessments. Basic math is one free assessment. Basic drug info, it's the top selling community drugs, is the other assessment. And you can get that by going to rxprep.com, clicking to go to the store where the products are listed, and scroll down and you'll see the assessments. I'd like to review why they're important to do. Well, there are students who have not been in school for a long time. I was just helping somebody that's about my age, which I'm not going to say what it is, but it's getting up there. And he did not remember things that he had learned in middle school algebra, like order of operands, or how many micrograms do you need to make a nanogram, because This gentleman was a community pharmacist for many, many years. He was retiring in Florida, so he needed to retake the NAPLEX. And there's also some people, believe it or not, that managed to get through pharmacy school without knowing these basic math skills. So please do the free math assessment. These are very easy to remediate if you need it. So if you miss any of those, let's look at the red column here. You got less than 100% on that math assessment. Then you can use the chapter in the 2017 course book, the one that has the roadmap on the cover. And that book, not the year before, but that version, has a new calculations chapter called Calculations 1, Math Basics. And it goes through those basic math techniques that you need. The other free assessment is the top sellers. It's about 270 of the top community drugs. And we have found here at RxPrep that some of the best schools in the country do not teach brand names. So it's nothing wrong if you don't know what some of these drugs are, because you probably do if you knew what the drug was. For example, Tessalon Pearls. That's a top-selling cough medicine. A pearl just means like a little capsule, and that's benzonatate. Or Altase is Ramipril. Flonase and Flovent are fluticasone, but one is for the nose and one is for an oral inhaler. And so mixing those up is not good. A lot of times when the generic name is bizarre or long, the physicians get in the habit of writing out the brand name, and so they're critical. NAPLEX does use a lot of brand names, and that top seller course is fun to remediate, I think, because we've prepared a test bank called Top Sellers. It's $48. You can remediate that way. I would do that because I like to take quizzes, but I'm known for being a little strange, actually, so you might prefer to use the course book. There is an appendix in the back of the course book that has the trade and generics in it for all these drugs. And then if you don't know what the primary issue is, you can use the index to find it in the book. So for example, what that course would test would be Benadryl is diphenhydramine, primary issue, it's sedating. Aricept is donepezil, primary issue, it makes people nauseated, and then it's hard to get the person to eat adequately, and so forth. Now, if you ace those two free assessments, you go on and you begin your NAPLEX study. Okay, now our method for learning the math is very different than learning non-math. So I'm going to be talking about how to master math and non-math separately here. Before I do that, I'd like to review how to use the RxPrep coursebook. And something new this year is TIPGAL and Key Drugs Guide. And the reason we put these in is to improve the pass rate among students, because the failure rate went up when the new exam requirements came out. There is a separate video being posted on YouTube called Exam Overview that I'm taping right after I tape this one. And that goes through the question types. And I'd like to assure you that the question types are not what caused the failure rates to go up. For example, the NABP got rid of K-type questions. K-type questions are 1 and 2, 2 and 3, 1, 2, 3, and 4, and used a different type of multiple response question that we refer to as select all that apply. The failure rates did not go up with that type of change. They went up when additional content was added to the exam and when the exam became an integrated case exam. So it's important for those two reasons to master the topics as I'm going to instruct you right here. Now, TIPGAL takes an issue that students generally find challenging and tells you how to understand it a little bit easier, or maybe a mnemonic that you can use to learn that material, and so forth. So when you see her happy face holding that light bulb there, please don't skip those boxes. Key drugs guide is very important because we are pharmacists, and pharmacists need to know when a drug is making a certain condition worse and when it's making it better. If a patient has put on weight and they started to take a drug that causes weight gain, you need to know that. So if you look in the weight loss chapter, there's a key drug guide for drugs that cause weight gain. And then there's another key drug guide for drugs that cause weight loss. So if you notice, key drugs guide is in a gray box. And that's because these are the drugs that you must know that either worsen, exacerbate, cause, or alleviate a certain condition. In most chapters, they're just drugs that cause the problem. For example, in heart failure, which drugs can make heart failure worse or cause it? And so drugs like the anthracyclines, doxorubicin and daunorubicin, very important drugs, they would be in the gray area. There's other drugs that you're much less likely to see that also can worsen heart failure, and they're in the box that is around the key drug guide. We didn't want to leave them out of the book, but we don't think they're likely to get tested on. And if you're using our test banks, you'll notice that we are testing on these drugs here. Here at RxPrep, our pharmacists are very experienced. We have somebody helping us with every specialty topic, but we only include basic competency. We've been doing this for a while and we're good at it. For that reason, I can attest to you that if you focus on the test bank, that's the material you need to know. Other students that do that do very well on the exam, and you don't need other material as well. I would like to ask you though, please do not ask us specific questions that you had on the exam. That's against board policy. We don't want them, and we don't want you either to jeopardize your license and your ability to practice pharmacy. So thank you for that. In the RxPrep course book, there is both underlining and bolding. Why is that there? Don't try to read this, but just listen while I explain to you. Amiodarone represents over 90% of all antiarrhythmic prescriptions, and it's used inpatient. All antiarrhythmics have to be loaded inpatient, but amiodarone is the one that you'll also see most commonly if you're working community pharmacy. It's an important drug to know very well. It's a top-selling drug. In fact, it's the only antiarrhythmic that's in the top-selling category. Amiodarone has some very important things associated with it. So, because the drug as a whole is very important to know, it's bolded. And what you specifically need to know about this drug is underlined. So if you look at the warnings here, amiodarone causes thyroid issues, hyper and hypothyroidism, and so forth. It's a highly photosensitizing drug. It makes people's skin turn bluish blackish. Not all the time, but if a patient is going to turn blue, don't you think they want to know if they're going to look like a little Smurf character? Well, they certainly do. It's really more of a darker blue. And so that's a very important thing for counseling. And there's a lot of counseling on the exam, because what do we do that's more important than make sure the patients know how to use their drugs safely? Okay. Now, I want to tell you a little sad story here. We had a lot of students when the exam first converted to the exam that became difficult, who did not pass and called us up asking for help, and the reason they didn't pass is they ran out of time. That's not a good thing, but some of the chain employers or residency positions, residency directors, will require you to be licensed by a certain time, or you just have financial stress, so you say, the heck with it, I'm sick of studying, I'll go test, but you haven't even started to review certain topics. That would be a sad story, because the way luck has it, you might get those topics on your exam. So I'd like to suggest to you that from now until the time that you test, you put everything that you need to know on a schedule. This sample schedule, I actually was in Barnes & Noble one night, and there was a young lady studying with our book. And so I went up to say hello. It was in the little coffee area. And I said, hey, that's my book. Well, after she almost had a heart attack, I noticed that she had this schedule. She was following the method that we recommend. So here's her schedule, and let's look at what she did. This young lady had API rotations, and she was at the hospital till 5 p.m., as you can see here. And then she organized her time till she went to bed. She had a dinner break right after her rotation. Then she studied hypertension for an hour, took a 15-minute break. Calculations for an hour, took a 15-minute break. Heart failure for an hour, and so forth. So the moral here is that she is not studying for more than 1 hour. She is doing calculations every other hour. Calculations are critical, because if you make a math mistake as a pharmacist, the patient got the wrong dose. And even if you finished calculations, I'm going to tell you in a moment how you know when you're finished. You'll still need to put time for calculations back the week before you test, the same way you see here. Because if you're not using these formulas every day, what do you think happens? Yeah, you're right, you forget. And then she had sweet dreams because she felt good, because she had put in a major effort. Now, when you're studying and you take those breaks, what you want to do is you want to do like the gentleman on the left. He's doing something to get the blood flow going up to his brain. There's very nice evidence that if you don't study for more than an hour, and then you take these breaks where you get your oxygen-rich blood flow pumping upstairs, your retention will be better. What you're doing is you're giving your brain a break to move the information from short-term into long-term memory. Your brain knows how to do that, but it needs quiet time in order to move the most information. So this guy is walking along, and he's not thinking about something that happened yesterday or something that's going to happen tomorrow. He's just noticing the birds are singing or the sky is beautiful, because that way his brain doesn't have to focus on the other stuff, and he will store more information long term. For example, if you take this break and you're walking around and you're thinking, boy, that gal or guy on my rotation is really hot, and it's almost the end of pharmacy school. Oh no, I'm not engaged yet. What am I going to do? I have to have lunch with that guy or gal tomorrow, but my preceptor wants me to round at that time. Oh my goodness, how am I going to ditch my preceptor? Well, all that worry and angst is taking away from your brain storage, so don't do that. And also, if you take a break by watching television or checking your phone or chatting, your retention is going to be lower. Okay, and now I'd like to review the specific study method. This study method works so well that we can take a student who has contacted us for help because they failed the exam. They call up, usually quite upset, and they say something like, I got a 48 on the exam. And if they use the method I'm going to review here with you, their score goes up so high that actually the board investigates them for cheating. And that's okay, because when you say, hey, I used RxPrep's course, they must be used to this because they'll release your score right away. And we're very happy about that as well. But what's happening here is that the student is using a method the second time that works for adult learners. Remember, you are an adult, you are not a baby. Babies learn very well passively, adults don't. So let's talk about how you can shove all this information in your head, in your adult head. If you're using the videos, let me address that first. I know that some of you are not, but if you are, this is for the non-math topics. You put the video in front of you, of course. You put the book on the table. You watch the video. The person who's lecturing that topic is an expert in that topic, and they're focusing on basic competency. So anything they emphasize that you don't know, you can highlight it, and then you study the highlights, and then you go directly to the test banks to make sure that you can now answer questions with that information. For math, you can't sit there and watch math. That's useless. So what do? You watch the instructor demonstrate how to do a sample problem, and then you pause the video. You do the problem yourself, and then do the rest of the problems in that section. When you get to the next bolded heading, you put back on the video. There are several examples of each type of problem written a little bit differently in the book, and you want to be careful to do those. Also, that section, that calculations chapter 2, explains to you how to pull information for math out of a case. You will need to be able to do that. So that can take a little time. Oh, where's the fluids that the patient was getting on February 17th? I need to calculate the flow rate. Well, if you're trying to figure out how to calculate the flow rate on the exam, you're in trouble. So anyway, that's the way to do math. Pause the video, do the math in that area, restart it again. Okay, before we go into the little details about how to use the test bank, I'd like to say something about biostats. I have been teaching biostats since 2001 for RxPrep, and I can tell you it used to be much simpler. It was just very basic terms and plugging numbers into formulas, and the formulas are very simple for biostats. One number minus another number divided by the first number. They're not difficult. But now there are questions, what does this mean? And there are more complex skills that are required. Jennifer Schmitz, who's one of our pharmacists here at RxPrep, has taken the issues that students are asking for help with, such as how to pull information from a short abstract, the abstracts of some type of study, how to find the composite endpoints in the study. And she has made a little video called Biostatistics Tutorial. You can see here it's under 20 minutes. And we posted that on YouTube. So where you found this video, you can also see the biostats tutorial. After you study the chapter, I would suggest that you watch that video. And if you need help with biostats, the biostatistics videos that go through all these formulas and issues such as which p-value would you prefer. If you've got a p-value that's less than 0.01 versus another one less than 0.05, what does it mean? What does it mean, or why is it that the pharmaceutical company is using relative risk, but the pharmacist is asking, that's very nice, what is the absolute risk? Why are they doing that? These things are all discussed in the book as well as the video if you need the video course. Okay, now I want to say just a word about PK. Please make sure you understand half-life. There's 3 different ways that you can calculate half-life or figure it out using a graph where the concentration is going down over time, and that's all in the PK chapter. Another thing that's in the PK chapter is a lot of terms that are underlined that are just extremely basic, like what type of chemical reaction destroys drugs in the gut? Hydrolysis, because you have acid and water and they do a lot of damage. But there are also in that chapter other formulas that are really too complicated for the way that NABP tests, but they're there. Everything else in our book is relevant to the exam. We have had people who have asked us for more PK. We put it in there, but we're tempted to think that you don't need a lot of it. And what you need, again, we're testing in the test bank. Okay, now you're splitting NAPLEX prep into math and non-math. So the first thing I want to talk about is non-math specifically. First of all, let's say you're studying heart failure, and you know that you don't know that topic well. If you don't know it well, watch the video or read the chapter, whichever you're doing. You know you don't know the topic well. But if you do know it well, and you go directly to the test bank, and you score less than 70%, guess what? You don't know it very well. In that case, you should go back, read the chapter, or watch the video. So you're either going to the video first because you know you don't know it, or the course book, or you're going to the test bank first. And then you're looking at the score, and if the score is above 70%, you're fine. You're not fine completely because you've missed some of those questions. I'm going to tell you in a moment what to do about the questions you've missed, but you don't need to go back to the book or the video. Now that middle bullet point here, the middle dash, I skipped. Let's read that together. This is when you would use the video. Okay, the topic has commonly used non-oral formulations that require counseling. And this is what that means. If you gave your mom a lisinopril tablet, 30 tablets in a container, no counseling, she would know what to do with it. She's taken tablets before. She takes a glass of water, swallows a lisinopril tablet, no big deal. But what if you gave your mother a Lovenox injection or a Spiriva inhaler? Does she know what to do with it? No. And if you give her something that looks strange, especially if it has a sharp, pointy thing at the end, she's going to be scared. And those drugs are used all the time, but they're scary to the patient and they require very careful counseling. All those conditions like asthma, autoimmune, migraine, osteoporosis, those are the big ones. Osteoporosis because of Forteo, which is an injection. Migraine because of the Imitrex injection, the stat dose. Those are very important. Now, if you don't have the video course, the newer drugs will have a patient demonstration video on the website. You could go to the name.com. So like Forteo would be www.forteo.com. There'll be a tab for patients, click on it and you'll be able to watch how a patient or an actor or a nurse demonstrates how to use that device. I would not suggest watching people on YouTube who watch how I inject my Imitrex pen, because frankly, some of them are scary. Okay, now when you're watching the video, remember to put the course book in front of you and highlight what the instructor is emphasizing, review, go to the test bank. You've got to be checking that you've absorbed the information. Now, don't do what's in this first bullet point. Let's read this together. You can go back and change the answer on the test bank until you have 100%. But if somebody asked you that information, you'd get a lot of it wrong. It might feel good to see, oh, I got 100% in acute coronary syndromes. Wow. But there's no correlation between knowing 100% of it and 100% on the test bank. My 18-year-old daughter, who hasn't gone to pharmacy school, would be able to change the answers till she got 100%. So that's not the way to study. We don't want the computer to be what you go back to after the initial time you took the test bank. You'll learn some of the information that way, but really not a lot. Okay, this is what we suggest to do instead. And keep in mind, this is non-math. I'll talk about math in a moment. For non-math, you want to make flashcards of the missed questions. So go out and buy 8 or 9 packages of 3x5 lined index cards. Find an old shoebox or something to keep them in. And then when you miss a non-math question, which is all the others, you pick up an index card, you write the question on the front, the answer on the back. If there's anything in the explanation that you don't know, you should be doing that, adding that, and then you put the card in the box. It's perfectly fine if you mix up the topics. In fact, you should be, because they're going to be mixed up in an integrated case, but you don't want the cards facing forwards and backwards, because then you'll see some of the answers. I'd like to review a little bit how to prepare a missed question card. So the first part, number 1 here, I mentioned, you write the question on the front, the answer on the back, and so forth. But number 2, I didn't. Let's read this together. First, it says, do not skip this step. It's critical. And the reason this step is critical is because of what's in the red box at the bottom. The neurons you have, you have. In fact, I've destroyed quite a lot of mine with drinking 2 glasses of wine at night for the past year. Well, so I have less neurons. You don't grow more is the point. But the dendrites do grow and expand. So you've got to wrap your brain around the information in order to have it stored in there. That's called active learning versus a baby that can learn passively. So how do you do that? Let's read number 2. Explain aloud to someone you care about, such as your mom, or to another pharmacist. You wouldn't want to explain to your mom the mechanism of action of a drug, because your mom would be snoring in a moment unless she happens to be a pharmacist. You have to explain aloud, because the evidence of retention for adults is that if you say it and you hear it after you've written it, you'll understand it better. Now, when you're explaining to someone you care about, you're taking the information and you're rewording it in your words, and that means you understood it. Here's an example. If I asked you how to cut up an apple and put a slice of cheese on top, you'd be able to do that because you've done both those things. But if I asked you how to compound an ointment in 6 steps, you probably would have to think about it unless you're a compounding pharmacist. And that's because you don't know it as well. But if you were to study how to compound an ointment and then explain it to someone else, now your mind is wrapped around it. I'd like to give you an example. There's a question that I wrote when I was doing per diem pharmacy in near South Pasadena, where I used to live. And this lady came in. She was 68 years old. She was Chinese, and she wanted a vacation override for Evista. So I asked her, why do you need a vacation override? She wanted 60 days worth of the drug. Are you going somewhere? And she said, yes, I'm going to Taiwan to visit my sister, and my sister's sick. I don't know when I'm going to be back home. So I said to her, okay, did you select your seat yet on the plane? And she said, no, why? And I said, well, it's important that you get up about every hour and walk up and down the aisle or do exercises in your seat. There'll be a card in the seat, that packet, that place where they put magazines in the seat in front of you. And the question is, why did the pharmacist instruct her that? And the answer is that that drug has very high clotting risk. In fact, that lady, being 68 years old, would never even have gotten estrogen for bone density because of clotting risk. She got a drug that has higher clotting risk than estrogen. Why in the world? Well, Evista is only used when people either had breast cancer in one breast, they're trying to prevent it in the contralateral, or they're scared of getting breast cancer. Who knows? Maybe that lady's sister had breast cancer, so she's panicked, I might get it too. And that is a common fear among many women. Now, if I missed that question, I'd write out my index card, and then I would explain to my mom, because it's a patient question, I'd say something like this: Mom, the reason the pharmacist told you that is because this drug can make your blood cells sticky. They stick together in these little clumps. And you know what, Mom? That's dangerous because they're stuck together in the vein, usually right the veins that are running up and down your calves. And that blood in that vein is shooting straight back into your lungs because it's going to go up to your lungs and pick up more oxygen. And that's dangerous, Mom, because if that clot or a piece of it gets into your lungs, you won't be able to breathe. And so the good news is that those cells aren't stuck together like cement. And if you just walk, you shake them loose and you make the drug much safer. Now, it took me time to figure out how to word that and explain it. But you know what? I am not going to ever forget that issue again. And so it ends up saving you time and, more importantly, passing your licensure exam. Okay, here's a picture of some index cards being collected in a little box here. And then every day you're going to take an inch or two of these cards. And if you're wearing a white coat to the hospital or pharmacy that you're working in, put about an inch in your pocket. And whenever you have a minute, you can pull them out. Now, if you know the answer and it seems very obvious to you, like this: boy, that's so easy. How could I have missed that? Well, it seems easy now because you wrapped your brain around it. Take the card and toss it into a corner in your room or wherever you're piling up these cards. But if you don't know it, or you know it now, but you're not sure you're going to know it on your test date because it's 6 weeks away, that's fine. Put it back in the box. That just means you need to look at it again. And so make a time of the day separate from your study time that you review these cards. I've seen many students like to review them first thing in the morning because their brains are fresh, or take a lunch break and review them. Okay, now compounding has become very important. because there were some pharmacists who were not very ethical, unlike most pharmacists, and they made sterile drugs, and they did not prepare them in an aseptic, using aseptic technique, and they got a lot of people very sick, and almost 100 were killed all around the country because they were sending these vials all over the place. And so compounding was big news for pharmacy, and now the new graduates are being tested not only on sterile compounding, which caused the original issue, but also on non-sterile technique. And many pharmacists who are graduating now or graduated a while ago and need to retest have not taken compounding at all. And for that reason, we taped the compounding this year in a compounding pharmacy, because this is stuff that you really do want to see. For example, how do you triturate on an ointment slab? How do you fill capsules? What is an ungulator, which is a very, in my mind, it's like a super expensive smoothie machine, but it's used, of course, to mix things up. What is an ointment mill? And you'll be able to see these things. You'll be able to see somebody garbing up for sterile compounding, so you can see the order that they put the clothing, the protective clothing on, and that will make it easier. The other option is to read the compounding chapters and to test yourself with the test bank. You don't need to know advanced compounding technique, because this is, again, a basic competency exam, but you should know the information in the book that is emphasized and that is tested in the test bank. The big thing we were missing in 2016 was the compounding, because those requirements changed when it was too late for us to update that year's book. So it's critical for this reason to be using the current book. Also, of course, there are 14 new guidelines in the 2017 and about 45 drugs. So you don't want to be using old material to study for your licensure exam. Okay, now what about case-based questions? Let's read some bullet points here together. Case-based questions can be the downfall. We have seen many students who call us up and say, these were all cases, I didn't know what to do, I don't have experience with cases. And so there is a test bank that is just full of integrated cases, because like anything else, the more you do, the better you're going to get. I'd like to address a common question that we're asked: should I read the entire case before reading the question? No, not in most cases. Some of them are very small, but usually you only have 2 or 3 questions for a case. You have a 6-hour exam. If you are reading every case, there's no way you're going to finish. So what do? Well, look at this example of a question. What is the mechanism of action of atenolol? You don't need anything from the case to answer that question. The next one you would. Let's read that together. How many milliequivalents of sodium did the patient receive from his maintenance fluid on 5/12? Well, you're not going to remember anyway. The patient probably received fluids on 5/11, 5/12, 5/13. So you've got to go back to the case, look for the right date, see what fluid he had. There might be more than one, but you want the one that had sodium in it, which is probably normal saline, half normal D5, some combination, and then you do the calculation. Maybe it was interrupted for a while. If they tell you the patient got, in the notes for that case, the patient got half of the bag. So if it's a 1 liter bag, they got 500 ml. So you'd have to go back to the case anyway. Okay, which analgesic is most appropriate for this patient? Well, if you get questions like this, then 4 or 5 of the answer choices are most likely contraindicated or very risky in the patient. The patient could have an aspirin allergy. They could be pregnant. They could have liver or renal failure or some type of impairment. They could have social issues, like they need to be alert because they're walking up on a high-rise building where they're doing construction, and if you picked an opioid, guess what? They'd fall off. They wouldn't have any pain, but they wouldn't be alive either. There could be big inducers or big inhibitors that would interact with some of those drugs, or there could be labs like, for example, if you had renal impairment, or you had indications from the lab that the patient had heart failure, you wouldn't be able to choose NSAIDs for that patient. Well, the only way to answer this question is to go back to the case and look for this material. NAPLEX has this funny thing where they change the number of responses. It could be 4, it could be 5. In fact, some of the select all that apply are longer options. So it's they change, but you should be able to eliminate all of them and get the appropriate answer. Now, for labs, something that is also difficult for students is identifying what's wrong with the patient based on the labs. NAPLEX does give you lab ranges, but they don't tell you what the labs mean. So you need to know if the amylase and lipase are elevated, the pancreas is in trouble. What drugs can damage the pancreas? Or CPK is elevated. Well, you're putting a lot of stress on your muscles. Which drugs can do that? And there are several in addition to statins, which most people know. So in the lab chapter, there is a really terrific table where we put together the labs that you'd see that are wrong, and then what condition that would indicate. So please be sure that you don't skip that. Okay, I'd like to also suggest that you use the Billboard memory tool, and let's do this together. I learned this technique when I was an undergrad, on how to put weird information into your brain. Because I ended up going into pharmacy, I've used it maybe 5,000-6,000 times, because when I see a drug name that is bizarre, I know I'm not going to remember it. So I stop for a moment and use my Billboard memory tool. And I remember doing that with the drug agatrobam, because when you store memory in an adult brain, you're storing it into a folder that you already have. You don't have a folder for agatrobam because there's nothing that sounds like it. In fact, I'm really convinced now that drugs should be named like George Foreman names his sons. He had a lot of boys, so he named them George 1, George 2, George 3, and George 4. But we don't have direct thrombin inhibitor 1, 2, and 3. We have names like agatrobam. And so when that drug came out, I right away used my Billboard memory tool. I'd like you to please try this with me. Close your eyes. Picture a big white billboard. It's going to be empty. And then in big block letters, put the name that you need to learn, agatrobam, and then put what you need to know about it. Well, this was the first drug in this class, and it was IV only, and it is still your go-to hospital drug if you have a patient with HIT. So their platelet count has fallen off a cliff. I have a little picture of a centrifuge tube here with a bunch of clotted platelets. So the platelets have clotted together. This is actually a clotting condition, which is why it's so dangerous. And the free platelet count has gone way down. So I wanted to remember it was my go-to drug for HIT, and it's IV only, and the name. Now, your eyes are closed. You've got those 3 things in your mind. on the billboard. You can see them all clearly. And then once you see them there, you open your eyes. This technique was taught when I was faculty, pharmacy faculty, which I was for 6.5 years. The dean at the time got us active learning training, and they taught the same thing, but they said to do it on the top of a white school bus. But it's the same thing. And I was very happy to learn that, because I know that this works very well. So this is another evidence-based approach to learning a lot of information. When you need to think of the name of a Gatraban, if you get a hit case, hospitalized hit case, you won't need to think of the billboard. Your subconscious or your insight, that smart part of your brain, knows where to go. So the word will just pop into your brain. Okay, another thing that is important for students that they ask us, what order do I use this big book in? Our suggestion is to read the exam overview first, or to watch the video on YouTube. And then if you've mastered the basic math, start with calculations 2, because you will need to be alternating calculations with all the other topics, so that should be knocked out first. And then for chapters 4 to 27, you do in any order. Those are the foundation material. They should be done first, because if you read the formulations chapter or watch the formulations video, you'll know how to study formulations, and you won't be worried about memorizing every formulation. And if you read the drug interactions chapter, you'll have little mnemonics that can help you with the big inducers and the big inhibitors and the big additive effects, so that when you see a big inducer or inhibitor, you are already trained. Look for a drug interaction. When those foundation topics are done, you complete the rest of the chapters in any order. And please use your API rotations as a guide. If you are working in a hospital and you go look on top of the refrigerator and see the drugs that are not in the refrigerator, like metronidazole is always sitting on top, right? It's a very common hospital drug. Well, if you see it there, you're going to remember that it's not refrigerated, and you'll also see the same ones over and over. A lot of the high-risk drugs now are on protocols, and if you see the steps in the protocol on how to use the drug safely, you're going to know the key safety issues about the drug. And that is probably what you're going to be tested on, because safety is the whole point of this exam, doing no harm. Okay, I'd like to review some NAPLEX mythbusters. And the first is, if I study the common disease states, I'll be prepared to test. Well, that's true if you only got those, but most people don't. The second one I've spoken about, if my scores are 100% on all the test banks, I'll pass NAPLEX. Well, you're kidding yourself, as I explained. And then what about this one? Ooh, I heard from my friend that he didn't get questions on oncology or renal. Yay, I'll skip those topics. Well, that means, you could have 5 people sitting in the room at the testing center, and one person has a completely different test than the person sitting next to them. That's exactly what's going to happen. I reviewed the study method for the non-math sections. Let's review the study method for the math sections. There are 4 calculation sections. This is students' scores. You can see she wrote 1, 2, 3, and 4. The first time she tested in section 1 of calculations, she got a 56 because she didn't know the formulas. She didn't know what common mistakes she would make, like not changing the units. The board is going to check that you're careful. And you might solve a problem one way and they ask for the answer another way. For example, milliequivalence is always solved in milligrams, but maybe they asked you for the answer in micrograms, or you had to transfer milliliters to fluid ounces or something like that. So you always have to be careful to answer the correct question, to round it correctly. There are very common math mistakes, like you didn't add the diluent, but the problem told you to add the diluent, and so forth. The major issue is not remembering the formulas. NAPLEX does not give formulas. There's a couple that we think you probably don't need to know, and those are Harrison-Benedict, the basal energy calculation. That's the most horrific formula in pharmacy. Nobody knows it. So we're making the conclusion that it couldn't possibly have made it through NAPLEX as a test question. But you should practice it once or twice. It's a pretty simple calculation. It's just very long. And you might get it. And then you would need to be able to plug in the numbers. The other one that most people don't know is the BSA calculation that oncology pharmacists use, which is Dubois. I've only had to do BSA calculation myself a few times because there's not many drugs besides oncology drugs that use it. There is a kind of common pulmonary arterial hypertension drug, so you'll see BSA being done a few places, but in fact that drug is calculated in, there's another PAH drug that calculates in nanograms. But in any case, there's a few BSAs throughout the book. Don't worry about where they are. Just worry about knowing the simple BSA calculation, which is called Mostellar. And if you get a problem where they tell you to use Mostellar, you'll need to use it. But you also might get Dubois, and that one you would want to plug in. That one requires the use of exponents, and exponents, how to hit the right key to calculate an exponent, is in the Math Basics chapter, because you have to know what to press on your calculator. The calculator issue, should I ask for a handheld or use the one on the screen? Those issues are addressed in the exam overview video that is being posted to YouTube as well, so you can watch that. Now notice that her scores are going up, because the more she does the math sections, the less mistakes she makes. So with math, you want to do a math section, like calculations 1, clear your score, do it again, clear your score, do it again. Which sections do you do this with? There are 4 math sections. There are 2 biostat test bank sections. One of them has the math in it, and that's the one you want to do the same method. Do the biostat math, clear your scores, repeat until you're doing them basically in your sleep. And I would flip over the notebook you're using, or keep an index card in the back of your box, whatever works best, where you're keeping track of these scores, because even though the computer keeps your last score, you want to be able to see the progress you're making. So just keep a little list like that. If you are taking the exam and you're thinking what a formula is, oh darn it, what's that formula? Honestly, at that point you should not be testing. So do the math enough times that it's easy for you. Okay, now most of the math is going to be short answer, what the board calls constructed response. You get a little box and you type in the answer. I give some examples of these in the NAPLEX overview video that's on YouTube. What you should do before you type the number into that little box is ask yourself some questions. Please get in the habit of always answering these questions when you're done with the calculation. Does the answer match the question? because a lot of math problems have multiple steps, but the board might have asked you the third step. A good example would be alligation. Maybe they asked you how many parts do you need of the higher potency instead of how much do you need, just how many parts. And you need to be very careful that you've answered the correct part of the question. The next bullet point says, is the answer in the correct units? This is a very common mistake that students make, is that they don't go back and check the units, as I mentioned a moment ago. The third thing you ask is, did I round correctly? Most of the problems are going to ask you to round to the nearest whole number, and all you do is enter the number in the box, not the units. Like if it says round to the nearest whole number and you have 303 milliliters, what you're entering in the box is 303. But sometimes they'll ask you to round to the 10th, round to the nearest 10 milligrams, and you have to do that. And the last point here is to look at the answer and see if it makes sense. If the problem is asking how many liters of fluid a patient will get, and you got 20,000 liters, we actually got this question in the office, your patient would have exploded a long time ago. So take a look and just see if it makes sense. If you get stuck on math and you have our help, which would be you have the video course, or RxPrep is going to your school to provide a live review, we're happy to help you, but we cannot help with math if we don't see where you went wrong. So it's simple. You got the wrong answer, take a picture with your math, whatever you just wrote out with your cell phone, and attach it to an email. The only email that you need to know is support@rxprep.com, and Salma or Michelle will triage those emails and get it to the right pharmacist who will be able to help you that day. Okay. Now, when are you ready to take the exam? 3 things, please. The index card box is empty. You've got a big pile of cards in the corner of your room, and when you get your great score, you can go throw them in a fire pit and have a celebratory bonfire. The math is simple. Calculations are known, and they're done without errors. And the third thing is, in the test bank is a 175 item practice test. When I'm recording this video at the end of January 2017, it's not up yet because we're checking it, but it will be up soon. Please do that practice test. If you follow this method, it will be easy for you to score very highly on that test. If your grade on that test is below 80%, you're not ready. Something went wrong. If you need our help and you've got it, please ask us. We'll be happy to look at that test and help you figure out what areas you need to brush up on before you go in and take that test. If any of these 3 things are not done, please delay the test date, and I will tell you, do not take the test if you haven't finished these 3 things, because students call us all the time and say, well, I had to take it because I was going to lose my job, or I had to take it because I have a residency and they wanted me to staff on the weekend, so otherwise I'd lose the residency. I would suggest instead that you go to your preceptor, who's a pharmacist. We tend to be very nice people, and say, I need another 2 weeks because I'm not done yet. They know a lot of people are failing, and they will try to do their best to help you, I'm sure. That policy that you have to test right away may not be coming from your store manager who wants you to be licensed. So you have nothing to lose by asking, but you've got a lot to lose by testing early. Some of the students are on visa issues, and they're going to have to test because their visa is going to run out. And all these things like the visa, the residency issue, the need for an employer is just emphasizing to you that you need to develop a schedule long before you take the exam and stick to the schedule. Okay, that's it for this overview. Here's our email. You can also go to the RxPrep website and click on contact, and we'd be happy to talk to you and help guide you along. The office staff will answer the phone. Anyway, that's it for RxPrep's high pass method. It's worked very well for others. It can work very well for you. And I'd like to thank you for listening and welcome you to the great profession of pharmacy. Best wishes.